Good evening, everyone. Thank you for joining All Access Belize. I'm your host, David Kafka, here in beautiful Placencia Village. And coming to you tonight, we have a very special guest, is Matthew Leslie. He's not a practicing doctor, but we'll get into his story and all that in a few minutes. Want to just give some people some time to come in, and he'll talk about himself, introduce himself and his story, if you will, and then kind of what he's involved in here in Belize, and then we'll take some questions from the audience. Also, we have Lindsay. She is here helping on the back end. She'll help us with the questions and things like that. So again, if you're new to All Access Belize, we do this once a month, and we try to give value. Nothing is for sale here. We just try to give value and bring value to people who are thinking about investing in Belize, invested in Belize, and just have questions or just curious about Belize in general. No questions off limits. We answer the good, the bad, the ugly. If we don't know it, we'll get the answer and we'll put it on the show for next month. So again, I am a real estate broker for RE/MAX. I have offices in Placencia and Hopkins, and I'm about to open up Corozal, but we have agents all over the country. I'm also a fund manager for Caribbean Capital Group. So we help you put your money to work by investing in Belize passively, and then we give you a return. And also I have a couple businesses. You know about my art shops in San Pedro. We're about to open another one in San Pedro and building one in Placencia. And so I like to stay busy, and I stay busy. And people say, if you want to get stuff done, give it to a busy person. And so that's why we have Matthew on here. So want to introduce Matthew Leslie again, and he is going to talk about introduce himself, and then we'll just kind of ask him some questions, and then we'll go ahead and take some questions from the audience. So thanks for joining us, Matthew. I feel guilty not calling you doctor, but I know you said don't, and so you can go ahead and tell us about you and where you're from and all that.
Yes, it's all good. Everyone obviously, when they hear health group and whatnot, the first thing they want to say is doc. I'm the managing director of the health group. It's Hummingbird Health Group here in Belize. I'm originally from the Cayman Islands. However, by way of family, my father and his side of the family are originally from Belize. Belize was one of the countries that we coincidentally started doing business in. Of course, seeing the need for expanded healthcare, I decided to stay a little longer than expected, and now we've gone full throttle here in Belize, which has been quite a good experience over the last year. Actually, this week was our 1-year anniversary on November 1st. Yes.
Congratulations.
Yes, thank you.
So,
thank you.
Tell us a little bit about Hummingbird Health. Where is it located? What do you do there?
All right, so Hummingbird Health, we have different entities. We have the Hummingbird Pharmacy and Medical Supplies. We have locations in Dangriga Town, and then of course in Independence, Mango Creek. We are the largest pharmacy company in the South. Seeing over, I think in our 1 year, we saw over near 40,000 patients that have come through for medication through our doors at some point. We also have the Hummingbird Health Clinics. We have the health clinic in, of course, Dangriga, the new one that has opened up in Mango Creek, and we're also looking at the Punta Gorda area. And of course, we have our mobile clinics where our doctors, of course, we come out to people such in the Placencia area, Hopkins and whatnot. So we come to them. Also, we service the Keys. And of course, we work along with a lot of the resorts and of course, our expats, our retirees in the Placencia area. We see a lot of them. So, we keep very busy. We also have our home healthcare services, which piggybacks off of the clinic. Of course, with that, we're able to see people that are unable to get out, people that are elderly or infirmed. and of course our organic line, of course, of our supplements. Of course, Belize is full of all sorts of nature, and we try to use a lot of that with our supplement line as well. So, taking the focus on a more holistic approach sometimes, more than just the general medicine that people normally do. Our doctors, of course, train staff, our GPs, surgeon. Of course, we have our access to our specialists and also our doctors that we network with in the United States as well. So, we're small, but we're quite busy, and we're looking to get a lot bigger down here in Belize.
Wow, that is awesome. So I heard a rumor that if you're at a resort and you want to see a doctor, call you up and you will send somebody over to the resort to, check the patients out, to give COVID tests, things like that.
Yes, so it's quite simple, the resorts reach out to us all the time because, when you're here on vacation, you don't really want to spend your vacation memories in a hospital or a clinic. So we come to you. So we have cases, a guest might have, gotten exhausted from a long day, or, they might have gotten maybe the sandfly bite or something. We have to come and give them a cortisone injection. So the doctors come out and our doctors come to them. So it's a lot more convenient. So, we've had cases where someone might have gotten a little tummy ache or something. We have to put them on an IV, but it's done from the comfort of their hotel room. And the guests really appreciate that because, it's a service that we extend. We call it, the kindness of Belize kind. I'll steal that phrase from you, man. So.
Right, man, I love it. Yeah, of course, we were introduced by Louis Blanchard, who I had the privilege of meeting him and selling him Mariposa Resort. And he told me about you, and I was like, man, I got to get you on the show. And
yeah, I appreciate it.
Yeah.
Lewis has hit the ground running here. I must say he's hit the ground running, for someone from the United States that just got here to Belize. He's hit the ground running. He's been very, very, advocating a lot of stuff for frontline workers. He just recently donated to the clinic some masks and shields for our work that we do with people. I mean, he's all, and yes, Mariposa, the best firecracker shrimp that you can get at their restaurant.
Yeah, he's he was a policeman. I was a fireman. So
and I was a police officer as well. That was my first job.
That's right. He did tell me that.
Yes,
so it was, just, it's great to have you, here, and it's great to have him. And like I said, he introduced me to you, and I'm glad you had the time to come on the show. And again, we're here to take questions. So if you have questions on medical here in Belize, and then of course, any general questions on Belize, I can answer. We're going to try to answer all the medical things first, medical questions first, because we have Matthew on, and then kind of, we can go from there. So put them in your question and answer box, and then also Lindsay will put in the chat box how to get in touch with Hummingbird Health. And that way, if you're down south, well, tell us, Matthew, what areas, what areas do y'all cover?
Well, we cover the entire Stan Creek area. And so that's kind of good by having a clinic branch and pharmacy branch in Dangriga, which catches this side. And then when you go down south to Independence, Mango Creek, you have the other branch. So we cover everything. And of course, our doctors are also mobile, as said before. So we're able to get out and about to reach people, as well as our nurses for just at-home care. And it's a simple thing where, some people, they may not have transportation, or for the tourists, and they may not exactly know how to get around. So we're able to get to them.
Yeah, that is so cool. And tell us a little bit about your plans, if you can share. I don't know what you can and cannot share, but we talked a little bit before we started, and you shared some things. I'd like, are you able to share what's going on with the plans and all?
Yes, I can. I can't get too deep into it. However, I am very happy to say that we have started our phased approach towards the development of a full service hospital here in the South. One of the things that we realize as a health group is that, certain procedures we were unable to do in the South, we would have to send them up north. to the larger hospitals. And we identified that as, the travel time, let's say having to go from Toledo all the way to Belize City is 3.5, 4 hours. That can be the difference between life and death in an emergency situation. So by having a facility here large enough to accommodate that, we're very excited. So right now we are in the early phase discussions, and this is moving on to the design phase now of a full service hospital. It would be the largest hospital in Belize once constructed, and it would define healthcare in Belize. I think it would take us as one of the leading healthcare destinations in the whole Central America. Of course, attracting locals regionally, internationally. So of course, there will be a bit of the medical tourism put into there, which I think is a great thing, great investment for Belize in the economy. But at the same time, taking healthcare to that level where the people, they don't no longer have to travel outside of Belize if needs be for certain procedures. Everything will be able to be done here. So we're very excited for that. And over the next few months, we will have an educational campaign as we would say, cross the T's and dot the I's. So we're looking very forward to everything, and I'm looking forward to 2022 and larger announcements.
Wow, that's excellent. We have been hearing a lot about a hospital going here, a hospital going there, and it seemed like everybody wanted to do their own, but nobody would come together, and that's, we never had a hospital. So it'll be good to see, Placencia kind of get something, kind of close. Can you mention where you're going to put it, or what areas you're looking? Is it going to be on the peninsula or where?
Well, we had to look at certain features such as on the peninsula, accessibility, closeness to water. So we wanted to push it a little bit back because obviously we have to build it to specs against storms or anything. Of course, Belize is in the hurricane tracking area, so to speak. And I mean, like anywhere else in the Caribbean. So we wanted something a little more inland, but we wanted something to where you're no more than about within the Stand Creek area, no more within, say, 30 minutes. So even if you're in Independence, Placencia, Hopkins or Dangriga, you're no more than about 30 minutes. So we've kind of isolated some areas that we're looking at near to the Placencia junction off the highway. So we're looking at some locations there, and I think where we end up choosing will be very ideal, so that no one has a distance to go. And that's one thing. Belize is a beautiful country. I love the time that I've been down here, but to get somewhere, it's a bit of a drive sometimes. So, and we have to admit that it can be long and cumbersome, especially if you're going back and forth. And I don't think someone wants to do a 2-hour drive to a hospital,
Right.
So,
especially with all the speed bumps in Placencia, that takes,
yes,
a lot of time.
And especially with having a hospital of what we are envisioning, we will see people coming down from other areas of Belize coming down to the south. So of course they will have longer commutes, but at least where we'll be located, we're not too far from Placencia. You'll have all the hotels, you'll have the areas that people can stay as well. So, get a staycation while your family member gets checked out, or for the people coming in, you'll have hotels nearby, and we'll expand our services for those people as well in the hotels and condos.
Yes, exactly. Wow. And what about like, what kind of services? Will it be some cosmetic stuff where people can come from the States and, like you said, medical tourism, and then stay at a hotel for a couple months or a couple weeks or whatever to recuperate? General surgeries, things like that?
Yes, we will have a range of elective surgeries that will be available, as we like to call them, cosmetically, reconstructively. We are hoping to put a burn center here in Belize, which will be a first.
Oh, wow.
We will also be having, of course, general surgery and specialized surgery. We will have a full scale of departments. Actually, when I was looking at the prospectus, it ran about 4 pages long, and all the departments and everything we'll be able to do. We will be a full service hospital. So, not to sound commercial, but we would be a one-stop shop for healthcare. So you come and you can get everything that's needed. And of course, at an affordable price, because I think one of the things that we've always practiced at Hummingbird Health over the last year of being here in Belize is being able to afford to live. And we want to make it affordable to live. And of course, we want to be able to attract the outside for coming in and saying, okay, you know what, I can come here to Belize, I can enjoy the beauty of Belize, but I can also get my health in check. Of course, nothing puts your health in check than just waking up and looking at these mountains or the ocean. I love that. So
Right.
it's a place that I can see that. If you look to your right, you're seeing the mountains and the rivers and the waterfalls. You look to your left, you have the beaches. So
Exactly, man. And what about, so it is going to be a private hospital.
yes.
So it's funded by investors.
Yes, we have investors that we have put together that are very eager to get, as we'd say, boots on the ground here. But at the same time, we will have our hopes to having partnerships with the government. Obviously, we have to make sure that the local population is serviced, and with our A&E of casualties and also our specialists. So, like I said, once again, it looks at the affordability of it all, and we do hope to move forward with having a development that everyone can enjoy, whether you're local, expat, retiree, regional or international. So I think we'll have a product and a facility and an organization that Belize can be proud of.
Wow, man, that's awesome. That is exciting. Can you go into like some of the pricing of, let's say you go to a hotel to check a patient in Placencia. Can you talk about like what a cost would be?
Right now, if we were to go see a patient, let's say you have a tourist there at a hotel, we went to go see them and, administer some injections or anything, or just a checkup or whatever. You're ranging at around, I'll quote US dollars, about 100 to 150 US dollars.
Okay.
So it's quite affordable, especially knowing what someone would normally pay, or even just for a regular doctor visit in the US. So it's quite affordable.
And you see the doctor maybe for a second. This is the doctor doing everything.
Yes.
So you get a lot of patient and doctor, talk, if you will, the time the doctor spends.
Yes.
So very well. And you don't have to leave your hotel.
Yes, and it's right there. You get the time with the doctor, and then of course we have our follow-ups. We don't charge for follow-ups. We want to make sure that the person leaves happy at the same time. We don't want them getting on a plane with any issues. So right. we've been very good with that, and we get a lot of frequent calls from the different resorts for many different incidents, as far as maybe someone getting a splinter, so or simple bandagings, or or anything whatsoever. So we're very happy with the way things have been moving. And like I said, once we have the larger facility in time, I think that will greatly expand itself. Of course, that would also lead to other services such as proper ambulatory care and everything for people that need transportation and shuttles and whatnot. So we do have a master plan that's been put in place that we will implement. So we're really happy with what the future holds for healthcare here in Belize. It's needed. You have other areas such as Mexico, Guatemala, Panama, which leads the charge on healthcare in Central America. So Belize should be no different. The people deserve no less. So
I agree. And what about timeline? Not cost of construction, but time to start construction, how long it will take to build this hospital, to when you're going to be seeing patients. I know it's up in the air still, but do you have like a timeline that you're shooting for?
Yes, we would like to break ground in 2022. And we would like to have phase 1 opened by the beginning of 2023. It is 5 phases. We are looking at about a 100-acre campus. And this will have a various array of the main facility, retirement area. We are looking at maybe a possible retirement, hospice, private doctors, the area for elective rehabilitation. There's the commercial side of things as well, in terms of opening to have shops or restaurants on the campus as well for people to use. Housing for our doctors, because keep in mind, we are going to tap into the resources, the wealth of resources here in Belize in terms of medical professionals. Belize has excellent frontline workers, and we are going to tap into the resources, and also in education as well. One of the things that we have talked about on the campus will to have an educational school of medicine for doctors and nurses. So we really want to tap into the wealth of knowledge and passion that people here have in Belize for service and healthcare, but also at the same time to bring in can attract many, many doctors to come in. We already have a list of doctors from all over, especially the US, that says, you know what, I could probably do a little vacation in Belize for a year or two. Let's go. So, I mean, we do have that waiting list, and I'm very happy to see that a lot of people are enthused by that. And we have a lot of people down here. Like I said, we have seen at our clinic quite a few thousand patients since we've opened. Keep in mind, the clinical side of Hummingbird only opened this year in February. But we've seen a number of patients, quite a few thousand, and many of them are now patients that we have records on that we are continuously monitoring and upkeeping, because we do believe in the long-term approach or healthcare, especially with retirees. We want to make sure we follow up and keep them on the right track. We want to see them here for a long time. And we're very happy to know that they're as excited, because we do talk about it. The doctors do talk. And of course, I'm one to never shy away from a conversation when they come by and see me at the office. So, you know, we're looking forward to good things, and having, you know, it's one big family of health, and we're looking forward to expanding that with this facility.
That's awesome. We always thought about a trauma center, you know, in Placencia, somewhere by the airport. And we figured doctors from the US would want to come for maybe a couple months and work half the time and play half the time and things like that. So it's good to see. Do you think the government will allow or help, you know, the doctors, the foreign doctors, to come in with permits and things like that?
Well, you know, this is stuff to be discussed once we move to that direction and we have the formal discussions. And I do believe that the Belize government is very open-minded in terms of healthcare and what needs to be done, and they will see that these are things that's needed. You know, of course, as I said, we will give priority to the Belize and local healthcare professionals, but I do believe that there are some specialties that will have to come in. But however, what we would like to be able to do is to bring doctors and let them pass on that knowledge. So if you have doctors coming in and you have all these young doctors coming up, help train some of them and pass the knowledge on. So, I mean, you know, this will be a revolving door of people in and out, patients and doctors alike. But we do hope to have a good team put together and make sure that we cover all bases. I mean, you can't have a good doctor and bad nurses. You can't have bad nurses and good doctors. Everyone has to work together. Everyone has to be at their best, the way I look at it. And we're very excited I would like to say we're going to pick the cream of the crop. So,
yeah, because I mean, it's kind of hard when you're thinking of open heart surgery. You know, do you want a doctor that's had 3 or 4 of them, or do you want a doctor that's had hundreds of them? And I think that's why so many people do leave Belize, just because we don't have the population, you know, which.
But, you know, I like to say, and this is in my time here, like I said, we've only been here in Belize for a year, but I'd like to say that, you know, a lot of people do go off to Belize, outside of Belize, because they may not know that certain services are actually available here. You have excellent hospitals in BMA and St. Luke's and you know, healthcare partners and BMC, and you know, you have excellent facilities up in Belmopan and Belize City, but some people just don't know, you know, and I've been very fortunate to meet some excellent specialists down here that are highly trained. They've been all over and trained all over, and they're now here in Belize back home. Just that people don't know. And I think that just the education on saying that these services are available, you know, would help people. Of course, some people do look at costs, and they may feel that going to Guatemala or to Mexico, to Merida in particular, might be a little cheaper. But, you know, always remember, not everything that is cheap is good as well, you know. Yeah, not everything that's good is cheap. You know, when it comes to your health, you know, what you want to do is you always want to make sure that you get what's best for you. And you do have a lot of good, caring doctors here that are very passionate about their work. And we want to make sure that at Hummingbird Health Group as well, that we're very passionate about our patients. You want to definitely put their healthcare as our number one priority.
And that's awesome. Yeah, thank you. So like I have a employee that had some thyroid cancer, and she had to go to Mexico because there was nobody here to do that. So are there plans for a cancer, you know, a cancer center, if you will? Or
yes, on oncology and everything, there will be treatment available, and we will be tapping into an oncology wing and everything. So no, people will be able to get treated here for a different array of cancers and everything. And of course, all of our different departments, gastrology, urology, internists. One of the things that I personally would like to see is for us to push very heavy on a diabetic wing for diabetics. Here in Belize, 1 out of every 4 people just about statistically are diabetic. I myself am a type 2 diabetic. So to me, it's something that I'm very passionate about. And we see it all the time, people coming in, amputees, people with foot ulcers, high diabetes. It's very, very rampant. But you know what? Blame it on the good food of Belize as well. That rice and beans. I think I gained a couple pounds.
Yes, it is.
But I'm really looking forward to pushing the diabetic. I really, really have a passion for that, and I really want to push that as an agenda for us. I would love to see diabetes properly taken under control here in Belize, and that will be one of the things that I myself personally will be pushing on very heavily. So I'm looking forward to working. So like I said, with the cancers, diabetics, other diseases and whatnot, chronic diseases, sickle cell, MS, everything that's under the sun, we will tackle it at some point, and we will make sure that we have the links, because one of the beautiful things about medical services is that we're one big family, so we can reach out, and we will create partnerships in the US and elsewhere, so that we can get the best of the best when it comes to treatment. So
right. Wow, that is awesome. Well, we have a couple questions, so let's kind of get to that, and then we'll kind of talk about some other stuff. So John, hey buddy, how are you, sir? He's a friend of mine in the States. He has a medical question. His wife is a certified nurse anesthesiast. Can a UISCRNA relocate to Belize and legally work?
Right now, we are looking into that. You have to have certain qualifications, which I believe is the US, the UK, Jamaica, a couple other countries. So they have to be certified there. So the answer would be yes, but there is a process, a paperwork process, and we are willing to work with our overseas employees coming in and getting their work permits and certifications down here through the ministry. One of the things that I do love about Belize when it comes to their Ministry of Health is they do have a very rigorous process of accreditation and licensing down here for the staff. We just went through our relicensing for one of our pharmacies, and they just don't give lip service. They come and they do excellent jobs. So the Belize government will make sure that whoever we bring in is properly vetted and whatnot, and she has the qualifications. Once we do the submissions and the background checks are made, it shouldn't be a problem. So to answer his question, we shouldn't have an issue as long as she has all her paperwork in order, and we can submit that. If she's someone that would come down here and apply with us.
Okay, good. I know I had a client in Hopkins. He recently just passed away, but he was a radiologist. He was a doctor, and he did mammograms and things like that. And he wanted to get certified here so he could have like free clinics. But the government wouldn't allow him to do it because for some reason. So, that was sad because he wasn't going to charge. He was just wanting to do it, and to help out. So hopefully I do know Belize is very strong about not taking jobs from a Belizean. So if a Belizean can do the job, it might be hard to get that certification or that work permit for that. So that's just what I know. But again, if y'all have partnerships with the government and things like that, then yeah, maybe y'all will be able to help. Deborah's hey Deborah, she popped into Hummingbird Health in Dangriga without an appointment. She was seen right away. The prescription was filled at the pharmacy next door. So she's asking about health insurance. Will y'all take health insurance, and which ones do you take?
All right, so right now, and thank you, and just to quickly backtrack on what your statement was, yes, we do hope to have a partnership with government that we will be able to bring in staff, as said. Like I said, these are all the exploratory things that we have to do right now. But one of the things, like I said, would be succession planning in terms of bringing in professionals that can train locally as well. That's going to be a big thing for us. I do believe that no matter where you go, healthcare professionals, you focus on your local wealth of knowledge, and then you branch out from there. So yes, but for Deborah, on her question with the insurance, currently we are taking insurance from Sagicor and RF&G locally, but right now we are exploring to expand that outside the scope with Aetna and everyone else that's in the US there and internationally. So that is something that we're currently pursuing, and hopefully over the next couple months, we should be able to put some arrangements in place, because we do get asked that question a lot. What people can currently do, of course, would be if they came in and they got services or prescriptions, of course, we can do all the paperwork that would be needed for their claims, so they could pay and then, of course, claim back on their insurance, for however their policies are written up. When it comes to healthcare, I hate talking about the financial things of it, because let me tell you something, it was up to me, healthcare should just be free for everyone. But unfortunately, that's not the case in the world. So we just have to make sure that we at least keep it to where it's affordable. But like I said, with insurance, we are working on with different partners to get established to take insurance. One of the things we get a lot of requests for is for the Veterans Association, the VA, and
Yes.
everything. So we're definitely looking into that, and we've already started that, exploring and reaching out to see who we can get on board with us. But locally speaking, Sagicor and RF&G, we have already set up arrangements. We're actually waiting now for a card machine to come in from Sagicor so that their members can just swipe the card. All the services are listed, all the billing's already done, and they just come in, get treated, and get right back out with ease.
Wow, man, that is awesome.
Yes.
Very good. All right. So, so we answered that one. Will you work with Sagicor? Okay, we answered that one. We answered where the hospital will be. Deborah's asking about the location. Did you look at the area where the airport is, Marcos Airport up in the north, quote unquote international airport, where it will eventually be in the key word. Did you look there? I mean, because where you're looking or talking about is kind of close to there anyways.
Yes. We have taken the look inside there, and once again, we want to make sure that we're in a very accessible place. So keep in mind, a lot of the Belizeans, especially those coming from the Toledo area, the Mayans and the Garifunas, a lot of them are commute by bus, even when they have to go to the hospital. So we don't want to be off the beaten track. So we felt that coming to the surface there, the Placencia Junction, which is the key word junction, is where we're able to catch everyone that's coming in there. So that is an area of that we've identified. However, that's not to say it could change, because obviously, we are still going through those steps of looking at locations. So, but we have looked at that area. That's Riversdale by the airport there. And like I said, when it comes to tourism, medical tourism, an international airport in the south will be needed, because if this thing goes the way that I hope it goes, and of course I have to talk now on a business perspective, I do believe that we will see a very heavy influx of people coming in from our northern neighbors coming in for treatment, because obviously we've already seen the model work in other countries. The Cayman Islands introduced Health City, and actually they just signed a $350 million campus with a group out of Dubai, Aster, to build a new campus. So it shows that medical tourism works.
Yes.
So I see Belize as being the next stop, but I think Belize has so much to offer. I mean, the beauty of this place is therapeutic on its own. So.
Right. Yeah, especially like where you're talking about. I mean, you're 10 minutes, you're into the largest jaguar reserve. You're 20, 30 minutes from an ocean, the Caribbean Sea, and horseback riding and things like that. So that's very good. Brad, good evening, sir. How are you? Will EMS services be run out of the hospital?
Yes, we will have an ambulatory department there, and we will actually, believe it or not, and this is one that I think will come as a big surprise, is that we are exploring airlift direct to the hospital by helicopter. So one of the things that we will look at investing in will be a helicopter. The reason being is, keep in mind now, you have a lot of guests that are out on the Keys. And if an emergency happens, it's getting a boat out to them, or let's say there's rough weather and they need to get in because of medical emergency, they don't have that opportunity. So we are going to be looking at investing in putting a helipad, and of course investing in a helicopter that will be able to medically go and airlift people to the hospital. And that will also cut down in terms of RTAs, road collisions, that are happening on the highways or deep in the south. Boating accidents. Keep in mind as well, in the south here, you have Harvest Key, the Norwegian port. So you have cruise ships coming in. Let's say that something needs to be done in terms of evacuating someone off the cruise ship to get to a hospital. We would love to have that service available. And not just through us, but then of course you have Astrum, and that's also here, that of course they use the helicopter for a lot of great work as well. At the same time, as the size of the hospital, and I will say that we are looking at a 200-bed hospital. It would put it as the largest hospital in Belize. I believe Carl Hughesner, which is the KHMH, the main hospital here, is 134 beds. So at a 200-bed hospital, we would be prepared for mass casualty of any sort. Heaven forbids it ever happens, but we are, it's best to be prepared. We've seen what the pandemic can do to hospitals.
Right. Wow. Yeah. And I have a client that he had open heart surgery at KMH, Carl Hughesner, and it was a bunch of doctors from the States that was showing how to do heart valves. And so that was kind of like what you were saying, where the doctors will come in, help the local doctors with education. I think it was Duke University that did that one. They were here for extended time, and it was just cool to see. So again, if you are just joining us, we're here with Matthew Leslie. He is with Hummingbird Health. He's the CEO, if you will, here, the manager.
The janitor. Yeah. The janitor.
Yeah, we have to do it all, right?
Yeah.
So please, if you have any questions, or if you have any questions on Belize in general, we'd like to kind of focus on this now, and on Matthew and his expertise, and what he has to offer, and answer questions like that. We will next month. We'll do this later, because I know this tends to be a little earlier, but this was already set up and we didn't want to change it. Lindsay will also throw up a poll. So if you can answer that, one of the people that answers the poll will receive a book of your choice. Either Success Habits of Superachievers. Don't Quit was one of the books I was had the privilege to co-author. Or we'll send you one of Robert Kiyosaki's books. So whenever she does that, if you don't mind answering, we'll give you, there it goes right there. Also, this will be taped. So if you happen to miss it and you have questions for Dr. or Matthew, sorry, he doesn't want to be called doctor. So if you have questions, Lindsay will put his contact info, or how to get in touch. Like if I want to call a doctor to come to my house and check me out or give me a COVID test, who would I, what number would I call?
Yes. So if you wanted to come in to see a doctor and anything like that, you can call us. And some people, I think, they can contact me directly if needs be. You can call us at any of our facilities, 672-MEDS, so 6337. They can also WhatsApp 613-MEDS, 6337. Or my phone is always an open door. I see that a lot of people prefer to hit me up. One thing about Belize, they go straight to the top, so to speak. So they're more than welcome to contact me at 613-0902 if they have any questions. Or they can email. They can email us at info@hummingbirdhealth.bz, or they can email me directly at matthew@hummingbirdhealth.bz. So, there's a big array. And of course, one of our most popular things is actually is actually is Facebook. We get hundreds and hundreds of messages on Facebook every week from people. Facebook has been able to help us reach out very heavily, social media on a whole. So they can hit us up on our Facebook page, which is Hummingbird Health Group. So they can look us up, Hummingbird Health Group, and they can get in touch with us through the messages. They can book their appointments on there. So there's different ways. But like I said, info at hummingbirdhealth.bz is the quickest way to get information sent across. Or like I said, the phone number is 613-MEDS, 672-MEDS, which is 6337, or myself, 613-0902.
But we don't want to bug you. We want you to be working on getting this hotel or this hospital open.
I think it'll be nice. I don't think, maybe it might look like a hotel, but it'll definitely be nice.
Right.
Oh, no, I don't mind it. One thing for me is I do work a lot, but I do like when I can check my phone and say, okay, these messages came in, this is cool, how you doing, blah, blah, blah. And I think a lot of people, they especially when it comes to healthcare, they want to talk about their conditions, they want to vent, and I have an open ear for everybody.
Good. Lindsay put it in the chat box. She put in all the contact info, phone numbers, email address, the Facebook page, and also it's the last call for the poll. So if you would, please fill that out so we can learn how we can better help you. Any final comments? Donations, will y'all be set up as a 501c3 or how is it strictly, for profit? What if, there's a lot of money out there floating around with, the US printing so much money. And so there are people that want to donate. So is there ways they can donate equipment or money to help build the hospital?
I think when it comes to the hospital itself, I think we should be okay financially speaking for that. But in terms of the services and everything, we will have a fund set up to assist people that are in financial straits, that cannot afford certain things. We will be working with many groups. I have spoken with, of course, a lot of people would know that I have very close relationships with Manny Pacquiao, the boxer, and he has his foundation, and we look forward to working with him on that. We've discussed that very intently. At the same time, yes. At the same time, we definitely will never be the facility that would ever turn anyone back. So we do hope to have a fund set up to help people that do come to us that's in need. Government does have their NHI and everything, and I do believe that will be something that we will work with as well. At the same time, as said, the financing on the large development, we will be fine for that. So it's not a case where we'll be looking for any assistance on that. Right now with our clinics, these are smaller. These are more what you would call labor of loves. We're very in tune with working with the population, the people here locally. So anything helps when it comes to equipment. I would prefer to see equipment and supplies donated more than money, because that equipment and supplies can go to a targeted area. Right. Whether it's getting additional EKGs, ultrasound, or bandages, you'd be surprised. The little things matter. We had someone recently, a patient came in with a bad laceration from chopping coconuts. And funny enough, the sutures and everything that we used for that person was actually something that an American that actually came into us donated to us. And it was like, it's good to see that stuff turn around, because it goes a long way. I mean, money is all good and proper, but I would like to let people know that, the equipment is put to better use. I think when it comes to charities, and I mean, we will have our setup where people can claim back once the big facility is open. We don't have that now, and I don't think Sure. It's limited right now. But, when it comes to money, I think one of the things that charities don't do is give good account. You have people that donate all the time, and then you find out that, for every dollar that you donated, only 5 cents actually went to doing anything. The other 95 cents, and I'm not bashing any charities, but I'm just telling it like it is. You have a lot of organizations out there that have taken advantage of good people. want to have good intentions. So for me, I would say, you know what? Don't give us money. We don't need it. I mean, of course, everyone needs it, but that's not the primary purpose. You know, we do this with a labor of love. But you know what? When it comes to supplies, we will always take supplies because it will get put to good use.
Good, right. Yeah, it's I was gonna say something, I lost my thought, but yeah, it's I understand what you mean. I mean, that's the first question I ask when I donate anything is how much of this is going
Yes.
to the, you know, to the cause, if you will. Because so many places, you know, like you said, we won't mention no names, but they don't, you know, like you said, 5-10 cents goes to, you know, the cause. Everything else goes for administrative costs. So yeah, that's good to know. Okay, what any final comments? So it sounds like this is going to happen. It's just a matter of time.
Yes, it's going to happen. Like I said, when we came here, 18 months ago, a lot of people wondered if the pharmacies would have happened, or the clinics. And here they are, they're open and we're just progressing. And, Belize, like any other country, especially in these areas, they have their social economic problems and everything. And a lot of people normally will come and take advantage of that. They come waving, what we call these fly-by-nights and these dreams, they sell dreams. We're not selling dreams. What we're doing is we're giving health, we're giving back. So, we are happy that we just, like I said, November 1st was our 1-year anniversary of being here. We've opened with our locations, with our pharmacies, with our clinics, more under construction, more to open up. We have gained great reputation down here, especially with our pharmacy. If we don't have it, we'll definitely try to get it for you. And I think with Melissa, my senior pharmacist, and my team there, I mean, we have definitely done a lot. Insulin, something like that was hard to get at one time, or phenobarbital for different medications that was difficult to get in the South. And these are things that, for Americans, they laugh at because this is something they can go into the CVS and just get. This was stuff that wasn't easy to always get, and now it's available down here. So I think we've come leaps and bounds in making sure that we've already established good healthcare down here in terms of getting an expanded array of medication. We have over $1 million in inventory just sitting in our storerooms and everything, and on our shelves of medication that is readily available. So when someone comes in, they need the metformin, they need the blood pressure pill, the nitroglycerin, the insulin, it's available. Our medical supplies, before someone broke a leg, they would have to make crutches. Now we have it available for people to purchase. So these are all the things that we're very happy of. And like I said, we are looking forward to the future. We are looking forward to our expanded talks. And we are looking forward to 2022, where we will actually be able to say, okay, we're ready to break ground. We've identified a site, we'll break ground, and then, we make it a reality. So we are looking, and with people like yourself, that supports us and gives us the shout outs like we're doing now, it just exposes the fact that Belize is improving in healthcare. It's getting there, and it will be a place that for people, and of course, we're not selling anything like you said, but for your people that are coming down, that are buying properties or coming for vacation, they can be rest assured that while down here, if there's any health issues, there's someone here to take care of it.
Yeah, I've actually had to tell people, if I was you, I wouldn't buy here, just because, the healthcare is just not down in the South, for certain people that have a lot of health issues. Yeah. If it's diabetes or something like that, totally okay. But, so it's good to see that it will definitely help real estate down here. It will help the local Belizeans down here. It's just a total, in my opinion, a win-win. And I'd love to have you back on. Well, it'll probably be a little later, so more people are out of work and can join the webinar. Yes. Once you break ground, just, you and I will be in touch and keep in touch, and then we'll have you back on, and we can talk about, the next phase, if you will. When the 200 bed comes open, will you still keep the other satellite places open?
Yes,
okay.
Yes, we will. Yeah, we will never close them. They will be open. And what we may do is use them as outpatients, so that people that visit us, they don't have to come back to us. We'll have outpatient clinics and everything. So no, there is a master plan in place to utilize all. So when we open the hospital, it doesn't mean that we close and shutter the existing properties, but we will be able to use them as extensions of the main facility.
Very good, man. Well, if there's no is there a question? Sorry, I closed the question box. I love the vision. So Deborah Stewart saying thank you so much for the session, and thank you for joining, Deborah. You're a faithful listener, and I'd love to see if, tell a couple people about this webinar, and we do it for free, and we love to have people on. So again, we bring on so we can bring value and educate people, and we'd like more people to learn about Mr. Leslie's vision, and I'm sure it will happen. You're right. So we appreciate you coming on, and again, we'll have you back on maybe in the first of the year or so after you got some big announcements.
Well, we'll make sure that we get you there for the groundbreaking when it happens. Who knows? Maybe Remax will help us with the property.
I would definitely donate some commission. So I wouldn't charge. So if that would help save money, I'd help represent you and donate the commission back. So if you need an agent, I'm always willing to give back in multiple ways here, because this is my home. Been here 12 years, and I love the people, and anything I can do to help give back, I'm happy to do so.
Excellent. Thank you very much. Much appreciated.
Thank you, sir, for joining, and everyone have a good night. Thanks again for listening. And yes, if you enjoyed tonight, please tell people. In a couple days, this will be on our YouTube channel, and then we'll provide a copy to Matthew's company and Matthew, so they can promote it as well. So we can get the word out that hopefully in a couple years, Placencia will, the Placencia area or the Stand Creek area will have in different phases, a 5 or 200 bed hotel in 5 phases. So thanks again for joining. And if you need anything, reach out to Matthew and Hummingbird Health for all your medication. And we thank you, and have a good night, everyone.